We'd just like to extend to you a welcome to the celebration of National Black Nurses Day here in Chicago. We're so glad to be here because it's been 2 years, and we're so glad that we can come into the house and we can celebrate and be thankful that we yet are able to be joyful. And at this time, I should bring before you our invocation by introducing to you none other than the Reverend Dr. Evelyn Collier Dixon, RN.
God of our weary years, God of our silent tears, Thou who hast brought us thus far all the way. Father, we come thanking and praising you for what you have done, what you are doing, and what you are yet to do in our lives. Oh God, how we magnify you, how we bless you. We bless your holy name. And Lord God, as we come this afternoon to this celebration of the National Black Nurses Day Planning Committee, celebrating Black nurses around the world, we just want to give you praise. We want to give you honor. We want to give you glory because it is you and you alone who has kept us. You kept us, Father God, and we have not been able to physically meet for 2 years, but you brought us back. You brought us back together, and for that we say thank you. Now, as we enter into this celebration, we ask if you would order our steps, speak to our hearts, and whatever we do tonight, we want to put a smile on your face because it is you who gets the glory, you who gets the honor and the praise. Thank you for those who have taken their time to come and participate in this auspicious occasion. So we give you praise, we give you honor, and we give you glory. In the mighty name of your Son, Jesus, we pray. Amen, amen, and amen. Amen.
Indeed, we say amen because God has been good, and we are indeed grateful to be here on this Friday evening. And what I'd like to do at this time is to have each one of the presidents of our various nursing organizations come to you with a welcome on behalf of their respective organization. So, first off, we'd like to ask a representative from the Health Faith Ministry here at Apostolic Faith Church to please give us a welcome. Sister Geraldine Peacock, won't you please come forward?
Good evening, everybody.
Good evening.
Tonight, I will not be giving the welcome address. We will have two of our members from our health ministry to do it. Asia, which is a brand new nurse, just passed her boards. Jan, Dr. Jan, she just finished her doctorate.
Good evening, everyone. On behalf of our pastor, Dr. Horace Smith, First Lady Susan Smith, and our Health Professions Ministry, it's with great pleasure that we welcome you to the Apostolic Faith Church. We are excited to have you as we all come together to celebrate and recognize the wonderful achievements, sacrifices, strength, and resilience of African American nurses. This year's theme of the 34th Annual Black Nurses Day celebration is Lessons Learned During the Pandemic. We have all come a long way by the grace of God, and I know we could all share many lessons learned from the last few years as Black nurses and healthcare providers. Black nurses play a critical role in providing all communities better healthcare. Here are a few achievements of Black nurses throughout history. Della Hayden Rainey was the first African American accepted into the Army Nurse Corps. She later became the first Black woman nurse promoted to captain and major in the Army. 1891, Dr. Daniel Hale Williams establishes the Provident Hospital and Training School for Nurses, the first Black-owned and first interracial hospital in the U.S. 1908, the National Association of Colored Graduate Nurses is established. The profession of nursing shares a long and prestigious history of African American nurses who dared to break through cultural norms to offer care to their communities. Throughout history, Black nurses have always showed up with integrity and perseverance. As a new nurse just beginning my career, I'm grateful to be a part of this community. So this evening, we are grateful to have the opportunity to celebrate because the profession of nursing is even more powerful because of our Black heritage. Again, we thank you all for joining in this celebration. We know that you will have a wonderful time this evening, and once again, we say welcome.
Thank you.
Thank you, Asia, for that welcome and reminder of who we are and from where we've come as nurses. Our profession is one of excellence and dedication. That's why tonight we want to welcome and salute all of you. Some of you are new to nursing, and some of you are like me, having been in the profession for more than 40 years. This annual event is hosted by 4 Black nurses organizations: the Chicago chapter of the National Black Nurses Association, the Alpha Eta chapter of Chi Eta Phi sorority, Beta Mu chapter of Lambda Pi Alpha sorority, and Provident Hospital's Nurses Alumni Association. Each year, these 4 Black professional nursing organizations join together to celebrate and commemorate National Black Nurses Day and to award scholarships to nursing students. At this time, I would like to ask all the members of the Apostolic Faith Church Health Professions Ministry to please stand up. This event takes place in February, every February, in honor of Black History Month. It is both an honor and a pleasure to have you here each year, and we thank you for allowing us, the Health Professions Ministry of the Apostolic Faith Church, the opportunity to serve you and join with you as you highlight the accomplishments of Black nurses here in Chicago and throughout the country. Again, we welcome you. Please make yourselves comfortable. And note, our community partners, Walgreens, are here to provide COVID vaccinations to anyone who needs one. May God bless you and keep you is our prayer.
And now we will have greetings of welcome that will be extended by the president of Beta Mu chapter of Lambda Pi Alpha sorority, followed by the Chicago chapter, National Black Nurses Association, and then lastly, the Alpha Eta chapter of Chi Eta Phi. Thank you.
Good evening, everyone.
Good evening.
The Beta Mu chapter of Lambda Pi Alpha sorority would like to welcome you to the 34th annual Black Nurses Day celebration, lesson learned during the pandemic, and also to acknowledge nursing scholarship recipients. I'm LaTanya Cannon, president of the Beta Mu chapter of Lambda Pi Alpha sorority. I'm also a member of the National Black Nurses Day Celebration Committee and Chicago chapter of National Black Nurses Association. Lambda Pi Alpha was founded in 1930 by Ms. Helda Margaret Little in Meharry Medical College School of Nursing on the campus of Nashville, Tennessee. The first chapter was granted in 1933. The second chapter of Lambda Pi Alpha, Beta Mu, was actually organized here in Chicago at Provident Hospital under the guidance of Ms. Little in April of 1934. The Beta Mu chapter here in Chicago has the distinction of being the only chapter which is currently active today. Our nursing sorority is dedicated to the sisterhood, education, and community involvement since 1934. We provide scholarships to deserving student nurses to continue their education, provide mentorship opportunities, community awareness around the continued need for appropriate health care. We support charitable organizations and participate in community activities. According to the Chicago Defender, the first nursing scholarship for Lambda Pi was awarded in 1935, and we're still going strong. In 2014, Lambda Pi Alpha Beta Alpha undergraduate chapter was organized at Chicago State University. In 2021, Beta Mu chapter awarded 2 scholarships to deserving nursing students, provided contributions and support to Grace House, which is a shelter for women who are exiting the Illinois prison system, vaccinated vulnerable members due to COVID-19, and also contributed COVID-19 prevention education material and baby supplies to the Christ Tabernacle Church in the Austin community, which requests ongoing donations as well. Membership is offered to any registered professional nurse who is in good standing and moral character in the nursing community. If you are interested in membership or the nursing scholarship, please visit our website at lambdapialpha.org for additional information. You are also welcome to attend our spring event June 25th at the Silver Lake Country Club. Students are also welcome. Thank you and continue to enjoy the celebration.
Next, we'll have Ethel Walton, President, Chicago Chapter, National Black Nurses Association.
Good evening to everyone. Good evening. It is with pleasure that I come before you. My name is Ethel Walton. I do use my middle initial L. And I would just like to say that the Chicago Chapter National Black Nurses Association has been participating in National Black Nurse Day from the very beginning. This is the 34th anniversary, and we have been at the table with the other nursing organizations from the very beginning. The Chicago Chapter National Black Nurses Association was founded in 1973. Our national chapter was founded in 1971, so we were not that far behind them. And feeling like that we needed to form an organization with nurses that take care of people that look like us and take care of people and make sure that they get the kind of care that others get without so many disparities, and so that the people that we take care of can also feel that they have someone that they can relate to. In our organization, we do have we start very early. We actually accept nursing students. We accept first-year graduates. We accept retired nurses. We accept doctorate degree nurses. And we accept bachelor's degree nurses. It doesn't matter. We're equal opportunity employer when it comes to that. And right now, we're trying to develop a program where we can catch the students even earlier, starting in 6th grade, because a lot of times, the earlier you catch them and they get a feeling for and a liking for something, you can continue to work with them and mentor them all the way through. We as well give scholarships. We also do mentorship, and we also do annual conference every year. Our national president is Dr. Martha Dawson, and this year we're going to have wait for it, the Chicago chapter and our affiliated sister chapters are actually hosting the national conference here in Chicago. We're going to be at the Hilton Hotel located right downtown, 700 South Michigan. The dates are going to be from July 26th through July 31st. And just so you know, we do have registration that's going to begin. The early bird special, you have to have your registration in for that by March 31st, and there is a special pricing for early bird special. So we're very excited. We also extend an invitation for anyone that would like to become a member of the chapter. We need hands-on, all on deck, and we would like for you guys to help us make Chicago shine as we move forth with our annual convention. The last time that we hosted it was in 2005, so that's been a very long time ago. And they loved it then, and we want to beat our record and let them love it now. We do want to say that the founder of our chapter, national, was Miss Lorraine Sams. And if you know anything about her, she was a small lady in stature, but she was very large in being able to get things done, and she moved and shook. She was a mover and a shaker, a shot caller, baller, and we will never forget her. We do have a scholarship in her name as well, not Chicago chapter, but national does. And so we would like to say that to be a nurse, it takes more than compassion, but you can't be a nurse without having compassion. And we want to encourage our students. We want to encourage all of you. We want to say that nursing is a proud profession, and it's also one of the most trusted professions. And we want to continue to encourage you to lean on a nurse. The doctors are there, but it's that nurse that's going to be there in the midnight hour, in the wee hours of the night. And we want to make sure that you know we continue to stand on that we care, and we continue to stand on that we want to make sure that you understand that caring is what we do. Thank you.
And now we'll have words of welcome from the Alpha Eta chapter. Chi Eta Phi.
Good afternoon, everyone. My name is Denise Heath, and I am not the president. I carry the office of the financial secretary of Chi Eta Phi Alpha Eta chapter. There are many of us in the room tonight. If Chi Eta Phi members would like to just stand, and we acknowledge you as being a part of this. We did not want to let this moment go by. Our president was en route, so I'm not sure what happened, but our Tamius, which is our financial business director or treasurer of our organization. So I am going to turn this over to the hands of our treasurer. Be ready at all times, right?
Good evening. My name is Gail Freeman. I am the treasurer of Alpha Eta chapter. I've been a member for over 25 years. And just a little bit about our chapter. Chi Eta Phi was established in 1932 in Washington, D.C. by 12 proud women who were not allowed to join other such organizations. So they established Chi Eta Phi. Our mission is service for humanity, and that is what we try to do by providing scholarships. We do community work with healthcare, servicing our seniors. We have a focus on taking care of children with, for our adults, we do heart health, kidney Sundays, and we are supporting a nursing home, a center for women, a shelter. We are very proud to give scholarships to nursing students annually, and over the years, I am allowed to say that we have probably given over $75,000 in scholarships. So with that said, I am so proud to be a part of this organization. It's full of women who care about people, who care about nursing students, and promoting leadership in the nursing profession. So to our nursing students, you can do this. Keep it going. We need you, we need you. I need to see you at the bedside when my time comes. So thank you so much.
Believe me, we do need you. It takes all of us working together. It does. And so we'd like to thank each one of our organizations for their words of welcome and for sharing a little bit about their history. It's important that we know from whence we were organized, what our purposes, our goals, our objectives, what they're all about, because we need another sister or another brother supporting us as we walk this professional road together. Now, we're going to go ahead and commence with our program. I'm going to ask Joseph Harrington. He's our opening speaker, and he's the co-lead of Chicago Area Patient-Centered Outcomes Research. Now, a little bit about Mr. Harrington. He's a native Chicagoan, and he is credited with working in the fields of education, social service, mental health, healthcare, and public health. He served as an assistant commissioner at the Chicago Department of Public Health and retired from there in 2017. He also had service with the Illinois Department of Public Health, and he served there as a regional health officer. He currently serves or has served in the past on several boards, which includes the Cook County Health Board, appointed by Governor Pritzker, and is actively engaged with the Chicago Area Patient-Centered Outcomes Research Network, known as Capricorn. He serves as a co-lead for the Patient Community Advisory Committee and its Steering, Coordinating, and Communications Committee. In 2017, he established the Mojo Group Ltd., which is a non-for-profit entity whose mission is to further the common good and general welfare of communities by working with and through the organizations and institutions within them. As the regional health officer and administrative judge for the Illinois Department of Public Health, I want to say he was responsible for the department's Bellwood Regional Office. And as the Assistant Commissioner for the City of Chicago Department of Public Health, he served as a departmental liaison for an $11.5 million CDC, Center for Disease Control, funded Chicago Tobacco Prevention Project. Prior to this, He also served as a project director in the Department of Preventive Medicine at Rush University Medical Center, where he oversaw its involvement in the Women's Health Initiative. He is a proud graduate of Chicago State University, a fellow of the University of Illinois at Chicago's International Center for Health Leadership. And he is also a former student at the Lombard Theological School of Theology in Meadville, and he has a strong love for philosophy. And we felt we needed someone with that expertise to come before us and to present. He is our opening speaker, none other than Joseph Harrington. Won't you please come forward?
I'm going to take off my mask to speak and acknowledge that I'm fully vaccinated and boosted. I want to thank my good friend, the Lieutenant Colonel, Dr. Sandra Webb Booker. I met Sandra in about 1979. I've had a rich history of working with Chicago chapter of Black nurses and Chi Eta Phi nursing sorority who have supported me throughout my career, so it's a pleasure to be here. I'm also here to honor the memory of my late aunt, Charlie Mae Alexander, who died last year at the age of 96 years old. She was a nurse. And some people say that not only was she a nurse for her patients, but she was a nurse for the family. When I was around 12 years old, my mother became gravely ill, had to have major surgery. Actually, she was having difficulty breathing. She had surgery on her lungs, and she was released from the hospital. My father wasn't capable of caring for us because we were running a small business, and we were sent to live with my aunt, who lived around the corner from my Aunt Charlie. But my mother went to my Aunt Charlie's house, who brought her back to health and restored her health and gave her an additional 40 years of life moving forward. And for that, I'm eternally grateful. So I wrote out my remarks because that's the best thing, because you don't want to lose your way. So bear with me as I try to read them with some degree of spirit. The Gospels of Matthew chapter 9, Luke chapter 8, and Mark chapter 5 contain similar stories about Jesus. In each he performed a series of miracles, and in each these words appear: "Your faith has healed you." Well, my grandfather's name was Mark. While my father's birth name was Mark, when he came to Chicago, he adopted the name Joe, so my birth name was Joe. But in 1979, my father and I had a long conversation about names and agreed that we would both embrace the name Joseph Mark Harrington. So I'm partial to the name Mark, and we'll read an excerpt from Mark chapter 5, verses 25 to 34. "And a woman was there who had been subject to bleeding for 12 years. She had suffered a great deal under the care of many doctors and had spent all she had. Yet instead of getting better, she grew worse. When she heard about Jesus, she came up behind him in the crowd and touched his cloak, because she thought, if I could just touch his clothes, I will be healed. Immediately, her bleeding stopped, and she felt in her body that she was freed from her suffering. At once, Jesus realized that power had gone out from him. He turned around in the crowd and asked, 'Who touched my clothes?' You see the people crowding around against you," his disciples answered, "and yet you can ask, 'Who touched me?' But Jesus kept looking around to see who had done it. Then the woman, knowing what had happened to her, came and fell at his feet, and trembling with fear told him the whole truth. He said to her, "Daughter, your faith has healed you. Go in peace and be free from your suffering." I'd like to share some information I found about the role of faith in healing, using statements from 4 separate articles. The first is by neurologist Dr. Ramses F. Ghali, a neurosurgeon for Ghali Neurosurgical Associates in Aurora, Illinois, followed by 2 from Dr. David Levin, National Institute of Healthcare Research, and end with excerpts from an article by Dr. Donald F. Smith from the Department of Microbiology, the University of Michigan. In Chapter 4 of Christianity in the Brain, entitled Faith in Medicine and the Role of Faith in Healing, Dr. Ghali writes the following: "Internal turmoil, worries, and doubts create an inner war in a person, which makes inner peace impossible and can contribute to some illnesses. Studies have shown people who have lost a spouse, gotten divorced, lost a child, or other major life crises are much more liable to contract a major illness, such as cancer. Many think such turmoil can contribute to contracting diabetes, coronary spasms, peptic ulcers, and indigestion, asthma, hypertensive, brain hemorrhage, and fatigue and hormonal imbalances. Negative emotions have been proven to increase the incidence of strokes, heart attacks, and hypertension. Psychiatric illnesses increase in patients with a disturbed personality or unresolved conflicts. Social isolation increases emotional stress and adversely affects immune functioning. Lack of family support can lower natural killer cell activity. On the other hand, positive emotions have been shown to correlate with increased immunity, body defense mechanisms, increase with patients with positive attitudes. Patients with honesty, self-identity, have realistic expectations, and do best during illness. Joy, love, and hope promote healing. He goes on to discuss the health benefits of religion. Religion guards against bad behaviors and their consequences. It results in a state of well-being, hope, and optimism. It provides a meaning and purpose to life. It gives rise to successful coping with adversity, low rates of depression, and greater social support. It produces a healthier lifestyle with documented less use of health services. I want to introduce you to a term I doubt you've ever heard of: salutogenesis. Salutogenesis is an approach to human health that examines the factors contributing to the promotion and maintenance of physical and mental well-being rather than disease, with particular emphasis on the coping mechanisms of individuals which help preserve health despite stressful conditions. In his abstract for the article, Spiritual Determinants of Health and Healing, an epidemiologic perspective and salutogenic mechanisms, Dr. Jeff Levin places special emphasis on concepts which he said are typically overlooked or misinterpreted in discussions of religious and spiritual factors in healing and health. They include the following: the natural history of disease, the epidemiologic triangle, which is made up of 3 components that contribute to the spread of disease: an external agent, a host, an environment in which the agent and the host meet. Number 3, the levels of prevention. Number 4, risk factors. Number 5, protective factors. Number 6, salutogenesis. And number 7, host resistance. In his article, How Faith Heals, a Theoretical Model, Dr. Levin defines faith as a belief acted on and instrumentalities of both affect and behavior. As he writes, belief and trust accompanied by an effort to put them into action ideally create a sense of hope or optimism or expectation that reinforce ultimately leads to reliance upon the object of one's faith. As a regular feature of one's mutual mental and emotional constitution, faith then presumably becomes a force for positive change in one's life and ideally in the lives of others. So how does faith feel? He goes on to offer 4 plausible options based on the work of Dr. Alice C. Paulson: suggestion, hypnosis, faith, and energy. Here's a description of each. Suggestion: through discussion, reading, recitation, meditation, concentration, and so on, inhibitory influence in either the mind or in the body are counteracted. Hypnosis: an altered state of consciousness induced by faith or a faith healer that enables one to marshal what today we might refer to as self-soothing psychophysiological mechanisms that enhance coping and mitigate pain, symptoms, and morbidity. The salutatory emotional effect of faith. Because of affirming God's omnipotence, omniscience, omnipresence, and beneficence, and the possibility of a personal relationship through which contact and communion with God is possible. The idea of a flow of energy, which some people call chi, to characteristic features of personality, mental attitude, mental states, and instincts, and finally to other forces not ordinarily recognized. In his article for Perspectives in Biology and Medicine, Functional Salutogenic Mechanisms of the Brain, Dr. Donald F. Smith from the University of Michigan writes that the brain has processes, functional salutogenic mechanisms that contribute to health by enabling one's outlook on life to benefit one's health. For example, the belief that things will work out as well as reasonably can be expected is a key aspect of the outlook of people who tend to stay well even when in potentially stressful situations. Believing in God, feeling happy, being mutually in love, and expecting things to change for the better are also outlooks that can be salutogenic. Beliefs need not be rational or realistic for them to be salutogenic, as shown by phenomena such as faith healing and the placebo effect. So hopefully, I've established that faith does play a role in health and healing. And let me say this: people that have faith have hope. And people that have hope have faith. 1 Corinthians 13 speaks to the power of love and reminds us that ultimately these 3 things remain: faith, hope, and love. But the greatest of these is love. Now, this is where you come in as nurses. You do your best to provide your best care to your patients. And because of that, they trust you to do the right thing. They have faith that you will do your best to help them get better, and more often than not, that's the case. You give them hope. In 1979, I had major surgery to remove a kidney stone. I was in the hospital for 12 days. My doctor visited me every day. but it was the nurses that cared for me 24/7. They made sure I was doing okay. They made sure I had enough to eat and got the rest I needed. They gave me the hope that I would get better and go home. They helped me when I couldn't help myself. And so as I leave to take my seat, I ask you to stand with me. Stand up. Not to applaud me, but to applaud yourselves for all that you've done and will continue to do. And for that, we love you.
That was so beautiful, because it lets us know that as nurses, we play an active role in that salutogenesis process. We are the change agent that can promote favorable changes, recovery, and resiliency. And that's why many of us are wearing green today, Mr. Harrington, because green is the color of resiliency. And we are resilient healthcare providers. We are here on one accord. Thank you so much. Our next speaker is Dr. Allison Arwady, MD, MPH. She is the commissioner for the Chicago Department of Public Health. She's the lead Chicago Department of Public Health. She leads, shall I say, the Chicago Department of Public Health and its 600+ employees. And she's doing all this during this COVID-19 pandemic while promoting the Chicago Department of Public Health's long-term mission to improve health equity and to close the racial life expectancy gap in Chicago. She is making strategic decisions in collaboration with numerous city officials and organizations to do so. She represents the Chicago Department of Public Health on the local, state, and national levels. It's part of her job to maintain and grow departmental morale, initiatives, and fundings, and to grow the data analytic capacity to use that data and to incorporate it in partnerships. Her history incorporates or includes service as acting commissioner of the Chicago Department of Public Health, chief medical officer and deputy commissioner, Chicago Department of Public Health, epidemic intelligence service officers, Centers for Disease Control and Prevention. That sounds like a military job. Okay, chief resident physician, internal medicine and primary care, Yale University School of Medicine, Connecticut. Intern and resident physician, internal medicine and pediatrics at Yale University School of Medicine. A research fellow with the Center of Disease Control. And her education includes the University of Chicago, where she was a civic leadership academy. She received a Civic Leadership Academy Fellowship. And at Yale University, she attended their School of Medicine. And at Columbia University, she was enrolled in and attended the Mailman School of Public Health, Harvard University. She has a Bachelor's of Arts in History and Literature and numerous certifications. I present to some and I introduce to others. Our Chicago Department of Public Health Commissioner, Dr. Allison Arwady.
Thank you so much. I have to start by apologizing for my voice. I want you to know that I feel 100% fine. I had a cold earlier in the week, but I've been having laryngitis. I'm keeping the mask on, and I've been taking a COVID test every day, and it's negative. But I canceled some radio interviews today because this does not sound like a voice you want to listen to about health. But I really did not want to cancel on this group. I very, very much, thank you. I really want to thank, there's a lot of folks I could thank. I'm seeing all sorts of voices and faces and people that I know and respect. I've already seen at least one nurse who's at the Chicago Department of Public Health. I particularly want to acknowledge Alderman Pat Dowell, the chair of the Budget Committee. And I know we're in her ward, and thanks to the church. As you know, probably, the bishop, Horace Smith, is on the Board of Health for the Chicago Department of Public Health, and he's someone who has been, a strong voice around making sure we're thinking about race equity in everything we do. So I really, I say no to a lot of things, but I wanted to say yes to the celebration for the annual National Black Nurses Day, and thanks to the Chicago chapter and all of the other partners involved. So when I thought about what would I talk about with you all today, I said, there is a whole lot that I do not know, especially about the challenges of being a Black nurse in Chicago. But what I do know, as someone who has spent the last 2 years working on trying to encourage people to listen and understand the science around COVID. And for years before that, thinking about how in public health and medicine and nursing do we not just take care of people after they get sick, but how do we set up systems and policies, environments that let people be well? What I have learned time and time again is that I can stand up and talk, but my words sound different depending who is listening to them. And when I think about COVID in particular and how hard COVID has hit Black Chicagoans, we're coming up, March 16th will be the 2-year anniversary of the first death of COVID here in Chicago, in a Black Chicagoan. And I don't have to tell you that at the very beginning of COVID, we saw this virus come through and just lay havoc on Black Chicago. And that's for a whole host of reasons. That has to do with the history of institutional racism and individual racism and people not trusting the healthcare system, and the fact that what puts you at higher risk for developing COVID? Not being able to work from home, living in more crowded housing, not necessarily having as many resources so that, you do have to go out to the grocery store and get the food and all of these things. And we really saw come to life what we've been talking about for years in public health, which is that health is not just about access to medical care, although that is crucial and nurses play the most critical role out there. It is about what decisions we make as society. And more than that, what we all do as healthcare professionals with the voice that we have and the trust that we have. We heard a mention about that nurses are one of the most trusted professions. Actually, nurses are the most trusted profession. Yes. And one of the reasons, I mean, I knew that in passing, but I actually have been watching this data fairly closely these last 2 years because, do you know one of the biggest predictors of whether or not someone has chosen to get vaccinated? Sometimes people think it's about, do they have the right information, and that's part of it. Sometimes it's about, do they know somebody who has COVID, who is part of it. Mostly what it comes down to is trust. And when you look at the, Gallup is the poll that does this annual, how do Americans feel about different professions? And yes, nurses were #1 still in 2021 with, I think, 81% of Americans saying they very highly trusted nurses, felt that they were honest, ethical, et cetera. That's first by a mile. Doctors actually are second, at least in 2021, but coming in at 67% there. But we saw both of those marks fall quite a lot. And I worry that we are seeing real erosion sort of at the societal level of some of that trust in you and me and our training and the science and our goals, which is of course always to help keep people healthy and return them to health when they get sick. And so I really have thought a lot about trust because we use it as a word a lot. But what does it mean for you to hear words that someone is saying and take them in a way that feels real for you? One of the most obvious barriers to that can be if the person you're talking with thinks you have nothing in common, right? And one of the reasons where we have seen, we've really tried at the health department to double down a lot on what does it look like to hire and promote from communities, in communities, where are trusted voices, how do we grow some of that community health worker that can support work of the nurses during COVID, just to give you one example of that. When we got a lot of funding for contact tracing, okay, like pretty early on in COVID, there was a lot of desire to move really quickly. And I was getting emails and calls from call centers and universities saying, we can do your contact tracing. But this was the opportunity to hire hundreds of Chicagoans and to think about what does it mean to train Chicagoans in public health, in the basics, in talking to people, in building that trust. We worked with the Chicago Cook Workforce Partnership, which some of you may know is one of the main organizations here that works to connect people who may have had barriers to employment to jobs. And then we funded 31 community-based organizations specifically across the west and south sides that were already working, some in the healthcare space, but some in social services, some in food access, some in economic development, because all of those areas are public health. And we really wanted to hire folks who lived in those communities and who looked like those communities. Because over time, those contact tracers, who we had no educational requirement for, City College has partnered to make sure we could do some earn as you learn. The only requirement was you had to be really good at talking to people, and you had to really care about improving the health of your community. We've hired more than 800 folks into that over the last couple of years. Some of them have gone on, to really amazing new growing things. And many of them say they've sort of found new careers in public health. But we're not done when we think about what does it mean to hire people in a short-term way? What does it mean to think about community health? What does it mean to think about the voices who are encouraging people toward their health, representing Chicago? It is organizations like this one, I feel very strongly, that encourage, the students and some of the younger people to see themselves, to say, this is the career for me, this is the profession, this is an honor to do this. And I love, the scholarships, the commitment, but also, 34 years, right? That's what I'm hearing of the annual work of coming together and thinking about the important role you play as nurses, but also the important role you play in Chicago as Black nurses, which I want to say first, thank you. I think, and thank yourselves. When I think about the progress that we have made in Chicago on health equity issues, when I think about the progress that we have made and continue to make every day in encouraging Black Chicagoans in particular to get vaccinated, for example, it is all of you who are the ones having the relationships with the patients, the ongoing opportunities to not just talk about something once or on TV, but to really listen to people. I'm not telling you, you're all the best at this. Why might people be hesitant? What information might they need? But also, how can we talk about the trust and the history of why people may not trust the medical system, the public health system, the government? You don't acknowledge that, you kind of can't get anywhere. And so I wanted to just finish with talking a little bit about Healthy Chicago 2025, which was in the brief introduction. For those who don't know, the health department, of which I'm, really proud to lead an amazing team there, we have really set as a goal that is years probably from being attained. But it is the right goal, and I think it is the only goal that we should be setting in Chicago. The goal is to work to close the racial life expectancy gap in Chicago. Yeah. And for those who may not know, even before COVID, Black Chicagoans live on average 9 years less long than white Chicagoans. And Latino Chicagoans have seen their life expectancy falling the fastest. There's a lot of reasons that go into that, a lot of structural reasons, individual reasons. But the main driver of that gap, number one, what do you think it is? It's chronic diseases. Even in the time of COVID, the number one killer in Chicago is heart disease, cardiovascular disease. And the biggest disparities is there. And that has everything to do with whether people trust the health system, but also whether they can access healthy food and safe spaces to exercise and not have the ongoing stress of, living in the society that we own the responsibility for building here. And when I think about chronic disease making up half of that gap, that's never what makes the news, right? The other 4 top causes, just so you know, for that gap are gun-related homicide, infant mortality, what we called prior to COVID, HIV and other infectious diseases. With COVID, we've seen that rise into the second spot after chronic diseases. And number 5 is opioid overdoses. These are all long-standing problems that are not going to be solved by a vaccine. But I feel so strongly that the need to build and rebuild trust in the healthcare system, to continue your work of making sure our healthcare professionals in Chicago look like Chicago, and to continue raising up those inequities. My voice is one voice. It's not the best voice in a lot of settings. And I really, really thank you for the work that you have done and continue to do. Right now in Chicago, the life expectancy gap, the gap related to COVID outcomes, the racial gap, is the greatest it has been. Because at the beginning, we had all of those underlying reasons, and those have continued and they are still there and still very much need work. But where we've seen Asian Chicagoans, about 84% of all ages now have had at least a first dose of vaccine, and we've seen about 75% of white Chicagoans and 75% now of Latino Chicagoans having had at least that first dose of vaccine. Latino Chicago got hit really hard by COVID too, but one of the biggest differences we've seen this year compared to last is that differing vaccine uptake has led to outcomes that look more like white Chicago than what they did the year before. But Black Chicago, still just 61% of Black Chicago has had a first dose of vaccine. And that means that in that most recent Omicron surge, most of the people going to the hospital, most of the people dying were the unvaccinated, and most of those people were Black Chicagoans. And so as On behalf of CDPH, I want to thank you for everything you have done. Let you know we are not done working on the thing that there is a vaccine for, even while we continue the critical work of long-term fighting for health equity. Please let me know and the department know how we can continue to support your work, and I wish you all the success. I hope this organization grows, prospers, and continues to do the amazing work it does. Thank you.
So, we learned a new term from Joe, and now it's been reinforced by Dr. Awadi that nursing is indeed the most trusted profession that there is. We've also had the confirmation that chronicity and the racial gap is really having a strong negative impact on people of color. So I'd like to say that we need to have a meeting with Dr. Awadi because we feel that there's some things that our nursing organization can work with because we do have a commitment and a love for our people, but for all people. We are humanitarians, and we indeed want to be of service to the community. The communities that we live in, but the outlying communities, because we're all one community, I believe, in God's eyes, because He created us all. Is there concurrence from those of you in the audience? All right, our next presenter, and I've lost my spot, is Dr. Phoenix Matthews. Now, Dr. Matthews is with the University of Illinois at Chicago, and she is a licensed clinical psychologist. She has completed her clinical psychology education and internship with St. Luke's Medical Center. She was a fellow with the Society for Behavioral Medicine Leadership Institute and Society for Behavioral Medicine as a competitive selection. Her academic appointments include professor with tenure in the Department of Health System Sciences within the College of Nursing at UIC, and she was a fellow with the Institute for Health Research and Public Policy at UIC. She presently holds the administrative position as Associate Dean for Inclusion and Equity within the College of Nursing at the University of Illinois. I present to some and introduce to others Dr. Phoenix Matthews.
Good evening. Thank you for that wonderful introduction. It's truly a pleasure to be with you here this evening and to share the stage with such esteemed citizens of Chicago's warriors in the trenches for health and well-being and for all of our communities. Let me see if I can get things going here. There we go. Okay, so I wanted to share with you the work of heroes this evening. Who are those heroes? All of you among us here, Black nurses, nurses of color here in Chicago and throughout the country. Sometimes with our heroes, though, we have to understand the toll that the role of a heroine, hero, soldier in the trenches can sometimes take, and the ways in which we need to be mindful of not just the communities that need to be served, but those who serve those communities. And in doing so, recognizing the fact that we stand on some very broad shoulders, those of you that are sitting here on this stage, those of you who are next in line for this work, and those of us all who are here who will be bringing on the next generation. There's work to be done. Most of this work is best done by those people who are in this room, but we're going to need support, and I'm going to talk to you about some of the reasons why and some of the ways in which we can make sure that the legacy continues of the powerful work of Black nurses here in Chicago and elsewhere. So as the most trusted profession in the country, nurses have been on the front line of this entire pandemic. From the very first days of caring for patients who were in the hospital, showing up with unusual symptoms, to when we were able to do testing and putting up testing clinics throughout Chicago, and also when the vaccinations became available, servicing in those vaccination clinics. I received some of my first tests by Black nurses in a parking lot in Hyde Park, in the communities we went and we served. But over the course of this pandemic, and even starting in the very early days, we were seeing that the stress associated with this work was having a negative impact on our nurses. And there was an early study that was conducted that showed that the mental health of nurses across the board were suffering. This study showed that 50% of the nurses that were surveyed had reported symptoms of depression and anxiety, and 33% of those nurses had symptoms of PTSD. What were some of the contributing factors? Well, there were numerous, some of which we've heard from Dr. Awadi. The excess deaths that nurses were being exposed to, those nurses who had been brought from other parts of the healthcare system to work on the ICUs, again, being exposed to higher rates of death and illness than previously encountered. Compassion fatigue, the amount of day in, day out work that needed to be done to take care of these populations. The lack of PPE, as well as the stress and exhaustion that has been experienced. But the research shows us, and many of you can give voice to this, that the tolls among the nursing profession has been higher among nurses of color. This one headline shows that, quoted, absolutely defeated, Black nurses struggle with mental health support while battling COVID-19. So what are some of the factors that are unique factors that have been impacting nurses of color, and especially Black nurses? I'm sure many of you can speak to some of those based on your own personal experiences. The first part of this is that it comes in context. This illness, like many of the other chronic diseases and acute diseases, falls on the long history of chronic disease among, maybe I skipped ahead, falls in line with a long history of chronic disease, but poor access to and poor quality of care among communities of color. So nurses going into this pandemic were bearing witness to some very stark inequalities as it relates to healthcare access and treatment. There was a story from last summer about an elderly Black man who was discharged early from a hospital in Georgia, who was found passed out on the sidewalk 2 blocks away from the treatment center, discharged early due to lack of coverage by insurance. Nurses have borne witness to this for years. We also have been in the midst of a controversy about vaccinations. Early vaccination hesitancy, rightful mistrust, earned distrust by of the healthcare system. So nurses were in that position of having to advocate for vaccinations and working with populations who had rightly so mistrust. And they themselves coming from and experiencing some of those same systemic exposures to systemic bias in healthcare and medical research, having similar levels of mistrust. But the story has stopped there, and it hasn't continued on to talk about some of the other emerging issues. As our hesitancy levels are going down, we're still struggling with access in many locations. And thank you to our partners from Walgreens who are providing vaccinations here on site for us today. In addition, you're doing your work in the midst of a politicized social environment where the Republican Party has used medical mistrust and distrust as a political pawn to blame African Americans and immigrant populations for the spread of COVID-19 in the state of Texas, blaming it on the lack of vaccinations among African Americans. In addition, we've seen what are some of the other factors that are contributing to stress, the high rates and differential impacts of death in the community. African Americans, Latinx, and Pacific Islander groups 2 to 2.5 times more likely to die of COVID-19 than whites and Asian Americans. So high rates of exposure in our communities. And given that many of our Black nurses work and live in high impact in communities, there is this exposure of high rates of disease and illness in the patient population, in their community environment, as well as their family systems. So this is not a job that you go home from. This is a community that you live, work, and reside in and serve, which contributes to the ongoing stress. In fact, 82% of Black adults report knowing someone who has had COVID-19 or who has been hospitalized. Again, nurses don't leave this pandemic at home. They revisit it day after day and within their families and their communities. Nurses have also paid the ultimate price in terms of their service in the pandemic. Nurses of color are much more likely to have themselves died of COVID-19 in lines of service, with nearly 18% of RNs who have died being African Americans, with the highest rates among Filipinos. So nurses of color, again, paying a disproportionate toll. Again, all of this happens in context. This is at the same time in which not only health has been stabilized, but the social fabric in many ways, as well as safety net institutions have been destabilized. So in the midst of this, we're seeing the pandemic has exacerbated our issues with housing, food security, uptake in opioid overdose deaths which has been referred to, as well as an uptick in violence. All of those, again, this is not to blame the victims. This is due to decade after decade after decade of segregation and concentrated poverty. But again, this is the work environment in which you're working. In addition, Black nurses have fought on the other pandemic that we've been dealing with for the last 2 years. That is the pandemic against the fight for racial injustice. And Black nurses have been on the front lines of calling racism a public health crisis that it is, marching over the last 2 years in the streets to help protest against police brutality and violence. In addition, nurses of color, and especially Black nurses, report high levels of racism in the healthcare system itself, with 92% of Black nurses reporting direct exposure and experiences with racism in the healthcare system. So Dr. Arwady was mentioning not being certain to be able to speak to the experiences of Black nurses, but those of you who are in this audience know these data to be true, these headlines to be true, and many of these experiences reflect those in which you live each day. Now, when we talk about these statistics and these realities, it's not to put our head down, to walk away from the challenge, but is to strengthen our spines and our resolve to do what is necessary to take care of the nurses who are in this room, to take care of our colleagues, and to take care of the next generation that will be following along. I want to just like a quick shout out. The next generation is UIC in the house. UIC in the house, we see you, we see you, we see you, we see you. So caring for one another, addressing the mental health needs of nursing of color, what's required? This is nurses especially of the organizations in front of us, have called out this epidemic of mental health needs and concerns of nurses of color and calling for a time of self-care. We have given community care. Now it's time for self-care among nurses. There have been a number of programs that have been established to provide free resources to nurses who are in need of mental health support. There are a number, I'm just highlighting one here from the National Black Nurses Association, right? Rethink and Reset, a new campaign and online resources for Black nurses. We also need to think about mentorship and support. Each of us are on the shoulders of someone else. Each of us have to provide shoulders for the next generation. So when we talk about mentorship, what is needed? We need to, when we think in the nursing context, we think about that general support that all nurses need. Right? How to be ethical, caring, compassionate, do the work of the nurse. Then there's additional support for those nurses who are indeed in the front lines of the ICUs. And then finally, there is a needed attention to those unique needs and concerns of Black nurses that I've been giving an overview of. Those needs within the mentorship context often remain silent or unaddressed because the lack of diversity in these nursing leadership positions in institutions, in healthcare systems, and in other administrative positions. So mentorship and increased attention to that. Dealing with self-care, religion, spirituality, meditation, mentorship, care of the body, mind, and in tapping into social support. Each of those things are needed for us to take care of ourselves as well as our sisters, brothers, and colleagues in the field. And finally, creating intentional community among nurses of color. I'm proud to present information about Black Nurses Matters. It's an online community, and it was started by Dr. Alicia Hart, who I have the proud distinction of having her as my first Black PhD nursing student that I graduated. And this is the work that she has contributed to. This is UIC, this is Black Nurses Matter. Thank you.
It's a small world. Dr. Alicia Hart was my student at the Chicago Public Schools Practical Nursing Program. One of my babies. Amen. Thank you so much. Our next presenter is Alicia Ann Cole. She's an experienced leader with over 26 years of progressive leadership and management experience. She's a graduate of the University of Alabama, Tuscaloosa, and also a graduate of the MSN and BSN programs at St. Xavier University. Presently, she's with the University of Chicago Medical Center, and she's an Associate Chief Nursing Officer, Executive Director of Adult Inpatient Services. She is additionally an adjunct nursing faculty member with the College of Nursing at St. Xavier in the master's degree program. She's had a past history of working with Cook County Health and Hospital Systems, with the United States Department of Veterans Affairs, with Ileana Healthcare System, and Jesse Brown, VA, my healthcare provider. So without any further ado, we'd like for Dr. Alicia Ann Coles to come before us.
Good evening. Good evening. It is such an honor and a privilege for me to be here with you this evening. I have been so impressed by all that I have witnessed, all that I have heard, and so very honored today to tell you above all else that you have heard, I'm a nurse. I would like to acknowledge and thank the Chicago Chapter National Black Nurses Association, Beta Mu Chapter of Lambda Pi Alpha Sorority, and Alpha Eta Chapter of Chi Eta Phi Sorority Incorporated, the professional nursing organization that I proudly represent today. I'm honored to share with you some of my personal experience during the last 2 years. The COVID-19 pandemic has tested our ability to safely provide patient care. I'll share experiences as a nurse executive leading in a very large, very busy academic medical center in the Hyde Park area here in Chicago, where we serve diverse patient populations, some of them severely underserved. Others fly in from across the globe to receive care. But I'm privileged to be able to be a part of an organization where I'm able to give back every day in a community that I grew up in, serving those who look like me and others who do not look like me. Thank you. As I reflect on the past couple of years, there have been many challenges. Those that are top of mind for me include the critical need for effective communication, staffing needs, the availability of personal protective equipment, PPE, emotional health, well-being, skill diversity, recruitment, retention, health equity, as well as access to care. I'm just going to highlight the first three today and some of the associated lessons that I have learned alongside other partners. So as I mentioned, I worked in a very fast-paced environment in which our average daily occupancy rate in the adult inpatient hospitals averages over 95%. That means on most days, every bed in both of the adult inpatient hospitals are full. Add COVID on top of that, and it created a very stressful and unstable situation in many cases. Fortunately, I work in an organization where collaboration and partnership, they are not just words. It's how we live, it's what we do. It's what we have to do in order to provide the care that is required for our patients and the community. So when it comes to effective and clear communication, we stood up our hospital incident command system. Those of you that are familiar with military or federal organizations or state organizations, I learned from those places some of the best lessons that I could have ever learned about Hospital Incident Command, or what we call HICS, being a part of those organizations for over 17 years. That knowledge came in very handy. It helped us to make sure that we had solid lines of communication between our internal stakeholders as well as some of our external stakeholders, such as federal partners, those that were responsible for accreditation compliance, as well as the most important groups for me, those that were actually taking care of patients. Once we stood down our incident command team, we integrated the conversation around COVID in what we call executive daily readiness huddles. So a part of our everydayness is to talk about what's going on across the enterprise. What are the needs? How do we best position ourselves as executives to be able to support those who are providing care, those who are taking care of the environment within the hospital, et cetera. But we also needed to focus in on COVID very intentionally and very specifically. As nurse executive team members, we were responsible for making sure that our team members knew what was going on. And as you recall, information was changing frequently, rapidly, daily, sometimes multiple times during the day. So making sure nearly 10,000 people knew what those changes meant and how it impacted them and their work was very, very important. So as one of the nurse executives on our team, it was important for me to make sure that my frontline staff in both of those hospitals were crystal clear on how to keep their patients safe and how to keep each other safe. So having said all of that, what lessons did we learn? We learned that when you think you have communicated effectively during a crisis, continue to keep communicating. Over-communicate. Don't assume that people will read emails. Don't assume that folks will dial into the many town halls that are offered to them. Be visible and engaged as safely as you can. And with COVID, our normal practices to do that were really strained. We couldn't just be everywhere and anywhere because of social distancing. But that didn't mean we couldn't be visible. It was about how we were going to be visible. Let me move on to the second topic, which is all about staffing. So COVID exposures, COVID illnesses, the need to care for family members at home, and the need for special accommodations for employees due to their own underlying conditions really made staffing a challenge every single day. Some of the internal strategies that I want to share with you included making tough decisions to scale back on elective surgical procedures, ambulatory care visits, restricting visitors, consolidating units, addressing some of the social factors that could have gotten in the way of our staff being able to report to work, such as they didn't have transportation or they needed housing. Why would they need housing? Because some of them lived with individuals who had underlying conditions, who were elderly, and they were literally afraid of what they would tell me, taking it home. So we stepped in to say, okay, let's partner with others to make sure that there's housing available, should they want to remain on campus. These are some of those strategies that we had to put in place. We had to consider flexible scheduling. What does that mean? Changing shift hours, changing shift times, changing days of the week that people worked. Some of these tactics actually enabled us to reduce the census and thereby have more staff to redeploy to areas where they had similar skills or competencies. Reaching out to local and national staffing agencies was really successful early on, but guess what happened? It got more and more challenging because of the inflated hourly rates that nurses, and I'm sure some of you know about this, were being offered. You can't compete with that. Doubling and tripling salaries. We had some of our staff to say, you know what, I love this place, but I'm gonna go jump on that contract right now, and if you'll have me, when I'm done, I'll be back. But this is an opportunity that I can't miss. And they say, so Dr. Cole, just to let you know, if I do this, I've done the math. I can pay off my car note. I can deal with some of the financial challenges that I have within my own family, so I'm taking advantage of that. And that you must respect. It was hard to watch, but I totally got it, and I respected that. And so we had to move on and think about how will we help keep patients safe here. So communication on our social media platforms became very important, partnering with our local schools of nursing, both colleges and universities, as well as some of our technical schools, very helpful. More recently, we actually introduced some pay incentives. We implemented mass new grad hiring events. So for nursing students out there, yes, give me a call. We are fully embracing having nursing students in the organization. We're embracing having new graduates. Many have joined already. And we got really creative here in thinking about what do we need to rethink. Associate's degree nurses prior to just very recently over the last 6 months were not able to apply in my organization. That is no longer the case. We have welcomed them back. We are fully supporting them. I am pro-ADN. I remember being a staff nurse working alongside an ADN, and I tell you, she ran circles around each and every one of us that had bachelor's degrees and beyond. She was an expert clinician, and she just did a marvelous job every day. We are seeing that today as we welcome these folks back into our organization. Not only did we hire them, we said to them, we want to support your continued education, which means if you come back and you're hired here, you have 30 months, 30, to complete your bachelor's degree. And it will be paid for by our organization. So I am so thrilled, thank you, to see so many nurses, especially people of color, who have said, I've been waiting for the opportunity and it's finally come. So there is a dual benefit to what I'm talking about here. Of course, it helps us as an organization to be able to serve our patients, but we are also helping our community. So what did we learn with all of this staffing challenges? We learned that we have to be proactive about cross-training our staff to be able to safely practice during a crisis. So an example is we had nurses from our PACU or our post-op recovery areas, similar competencies to some of our nurses in the ICUs. So we had to stand up just-in-time training for them to say, look, we need you in the ICU right now. We're going to take today to walk you through what that means. So imagine what we might be able to do in a post-COVID environment where we're proactively planning and standing up these various training programs to help our workforce to be better cross-trained. Lastly, I would be totally remiss if I don't touch on infection prevention. The COVID-19 pandemic threw us all into the world of infection prevention and into a scenario that we hope to only see on TV, right? Well, it was right in front of us. In partnership with our infection prevention team, nurses played a key role in prevention and decreasing the spread and risk, I should say, of spread within the community. Each of these relate to staff being able to come to work. Therefore, there's a direct impact for whether patients can receive care. In partnership with our supply chain team, nurses had a voice in which supplies were purchased, which ones were not. They helped us to stand up and manage COVID testing and vaccination clinics. They were even assigned to work on designated COVID floors, entire wings on 2 units, where these patients either had COVID or we were ruling them out for COVID. As we restricted visitors, they served as surrogates for family members. They set up virtual connections via Zoom, social media platforms, and of course, they held the hands of some of our patients on the behalf of their families. All of these tactics and strategies helped to minimize exposures, yet we did learn a couple of things. We anticipated additional surges based on what we were hearing from subject matter experts within the state, the city, as well as from the CDC. And we were interested in feedback from our staff about their lived experiences during the initial COVID waves. We surveyed the staff and they said to us loud and clear, the COVID units sounded like a good idea. However, it left me feeling isolated, on my own, and never, ever, ever do that again. Talk about unintended consequences. The second and most critical message was simply to lean in and to be fully attuned to what those who were doing the work had to say. We stood down all COVID units during the first and second surges of COVID, and since that time, we have assigned our patients to whatever units and areas that was most appropriate for them, and nurses across the entire enterprise and physicians across the entire enterprise, the entire care team safely has rendered care to them. The staff expressed appreciation and confirmed, yep, that was the right thing to do. As I wrap up, I find it important to share that there are some gifts of COVID, if you will. These would be the positive lessons we've learned, innovative practices, or simply shifts in the way we think about our work as healthcare providers. The things I hope that we carry forward into our post-COVID environment include efficiencies related to virtual meetings, increased use of telehealth, increased interdisciplinary collaboration, broader nurse recognition, continued focus on and support for wellness to include emotional health, psychological safety, and work-life balance. When applicable, the latter includes or could include compressed work weeks, working from home, and the ability to take a day off just because you need to take a day off. During the pandemic, yes, we learned that we had to do all of that, really a paradigm shift in the way we thought about how people show up when they show up for work. Now, don't get me wrong. On my side of the block at the university, all of my teams are there 24/7. They can't do their work from home. But there are other nurses who serve in different ways, who do not have to be on campus in order to do their work and do it very well. Thank you again for the opportunity to engage with me on this important and current topic. I extend my thanks for all that you do in support of our patients and our community and each other, and I'll be happy to take questions during our question and answer segment. Again, thank you so much.
Our last speaker is Dr. Terry Mason, MD. Terry has served as the Chief Operating Officer for Cook County Department of Public Health, 2013 to 2020, the Interim Chief Executive Officer, Cook County Health and Hospital Systems, 2011, Chief Medical Officer, Cook County Health and Hospital Systems, 2009 to 2011. Commissioner, Chicago Department of Public Health, 2006 to 2009. Partner, Uro Partners, Chicago, practicing urologist, 1986 to 2006. He's also served as the radio host for The Doctor in the House. His education includes a Bachelor's of Science degree from Loyola University. I would like to share with you, he started off as a nursing student, then switched over to medicine. He is a graduate of the Abraham Lincoln School of Medicine, the University of Illinois, General Surgery, University of Illinois Metro Group Hospital, Urology Resident, Michael Reese Hospital, American Board of Medical Examiners, 1980, American Board of Urology Certification. Our last speaker, Star August, was going to speak to the disparity in maternal health. She became ill, and Dr. Mason willingly said he would rise to the cause. So let's give him a round of applause. Dr. Mason, please come forward.
Good evening. And thank you for your patience and your endurance. To all of the speakers, the dignitaries that are present here tonight, to my cohort in crime and public health, Dr. Allison Awardi, we've had our times back during the early days of COVID. And what I would like to do is not so much talk about the maternal issues, as much as something that is really sort of underlying most of these disparities that we talk about. We always talk about disparities, and I was telling Mr. Harrington when I came here that I want this to be the last disparities talk I ever give. I'm sick of it. And this one's not going to be as much about disparities as it is about some other things. And the reason I said that is because I'd like us to move to a more solution-oriented situation. We keep talking about the problem, but where are our solutions? And how do we begin to craft conferences and conversations around those things? Let me tell you, why do disparities exist? The answer is because they're supposed to. I know that's not the answer you were thinking that I was going to say, but it's true. And let me tell you why it's true. And some of this is as a product of my own lived experience. Racial and ethnic disparities exist because of the country we live in. Racial and ethnic disparities exist because we have had to deal, we call it nicely racism, we call it all kinds of things. But you got to remember, we didn't come here as welcome citizens. We came here, many of us were brought here, although if you read some of the other treatises, that we were already here before Columbus got here. But for those who don't read books by people like Ivan van Sertima, who wrote They Came Before Columbus, let me just go back and give you a little bit of history. The whole notion of this difference because of race was brought out of an idea to begin to bring into fruition this concept around white superiority. Some people even call it global white supremacy. There's an author who writes talking about global white supremacy as the major undergirding of this particular process. Well, what did that mean? And what does it mean even still today, even in those of us who have educated ourselves and proved ourselves beyond a shadow of a doubt to be not only as good as, but in some instances better than our colleagues that don't look like us? I just want to take a minute to say that what we have to understand, if I had to think of racism or global white supremacy in any sort of way as its particular impact on black people, and I know this is not the topic they gave me, but this is what I'm going to talk about. Because it's too important. And all of us, every single one of us in this room has had to deal with it on one level or another. And some of us still dealing with it. But let me just give you this. If any of you remember the AIDS epidemic, does anybody remember AIDS, HIV epidemic? And if we remember what AIDS was, or what the immune deficiency virus did, what it did was it took away the person's ability to fight an infection. That's what white supremacy has done to black people. It has taken away our ability to understand our own self in a way that helps us do the things that we need to do for self. What do I mean? As I looked at looking at this issue around maternal child and all these issues, it always seemed to come back to that the black-white differences aren't necessarily because of our melanin. It wasn't because of any of that. It was because of the environments that we had to live in and the things that controlled those environments that we had to live in. And even more importantly, the policies that came out of these things that guided the development of the environments we had to. Let me give you an example. Many of us have had to deal with situations where we had to be careful about what we said. We had to be careful about how we said it. We had to be careful about what we wore. We had to be careful about how we sounded. We had to be careful about our own little idioms that we amongst ourselves use, but sometimes it might be taken wrong by others who don't quite understand us. Am I talking to myself? Okay. And so, and even, I don't care how many letters come after your name, with how many periods you had after your name, it didn't always erase the difference you had to suffer as a result of the color of your skin. You know, Joe said that I started out at Loyola University, and I was going to go into the nursing program at Loyola University, and I was expelled. I was expelled because I didn't behave well. I mean, it's a true story. They thought my behavior was so aberrant that they actually sent me to psychological departments for evaluation and counseling. And when I walked in and saw the person who was supposed to be treating me, I didn't know what he had at the time, but it was Parkinson's or something like that. And he was just trembling like this, uncontrollably. And I said, well, they sent me to see you, and you need a damn doctor yourself. Then they wanted to throw me out. But anyway, that all became history. And that's a true story, totally true story. But one of the things that I wanted to talk about is going back to the HIV, because I want to talk about that in terms of what race, what this supremacy strategy did. If you remember what HIV did, it took away your ability to fight your own infections, right? It disarmed your immune system. Where our identity immune system was disabled with the implementation of white supremacy. And it reflected itself in every facet of our living in terms of everything from the beginning in the Constitution, when we were not even considered full people, when we had to deal with this whole 3/5 of a person that had to really do with tax apportionment, but also always having to be almost apologetic for who we are. And even as we moved through the academic circles, we had to change ourselves a bit to fit in that academic mode many times. Some of y'all know what I'm talking about. And what that meant was we couldn't be too black. We couldn't be this way, couldn't be that way. We had to speak a certain way, wear our hair a certain way to be socially acceptable. Socially by whom? And it wasn't just by whites. Here's why I talk about the immune deficiency thing, and I want to stop. Our own identity of who we are, but more importantly, whose we are, was taken from us. And it caused us to try to be something we never could be, and never could be as accepted as what we were trying to be. And it was so ingrained in us that we began to look down on each other, particularly if you happen to be slightly darker than me. in a movie that came out a few years ago called Dark Girls. In the leading trailer on the movie, there's a girl about 18 years old. And she says, I took my skin color from my father and I hate him for it. That's pathological. I'm saying this because this situation creates an environment where we're bringing children into the world. And we've got all this violence that you see today and all these other things that are happening with children. And much of that is because of the image they carry of themselves. And you see these multiple shootings. And if you ever talk to anybody, and he's really get seriously talking to some of these young people, as we have, they'll tell you, oh, that ain't nothing. He ain't nothing. Because he ain't nothing. He doesn't believe he's anything. He doesn't believe he or she is worth living. And so when we look at these disparities, the disparities exist because if you look at the trajectory of our history in America, how could there be anything but a difference in our outcomes? How could there be anything but a difference in the way the laws that handle who could get federally guaranteed mortgages from the FHA through a process called redlining that excluded us from being able to get the very things that help us build the most equity and the most wealth in your life? A house. How could we begin? I was just talking on this Saturday, this is a shameless plug for my radio show. This Saturday we're going to have a conversation about, was integration a failed strategy? Was that the right thing? And I won't talk about that now, but I just want you to know that's what we're going to be doing about that. Because when I look at these neonates and we look at the differences, do I have any public health nurses in the office, in the audience? Any public health nurses? Right here. Anybody remember a thing called APORS? Remember APORS? What does that APORS stand for? Right. And these children had to be visited on a very intensive schedule. Is that right? And when I would meet with my director of nursing at the health department about visiting these children, just as these children were now living in a situation where many times they're couch surfing. They're sleeping on somebody's couch this week, somebody else's couch next week, somebody else's place the next week after that. But even more importantly, we discovered there was also food insecurity. That they didn't always have food because they didn't always have a transportation and they didn't have this. And when I sent some of the people out, we went to film some of these things, and you walk in these visits and got permissions, and you walk in and sometimes there would be things crawling on the very couches that these babies had to sleep on. And some of the people who went the first time were like, ooh. I said, but just think about it. This woman has no choice. And the reason I say this, because just as the internal environment of the womb helps to determine what kind of issues the child is going to have, the external environment to which the mother is exposed helps form that internal environment. And so oftentimes these things happen. And I'm not a neonatologist. I don't even play one on television or the radio. But I do know enough to understand that these things, as we looked at food insecurity, housing insecurity, and all the other things, but more importantly, just not knowing where you were going to sleep every night. Being subject to the whims of the girlfriend, the boyfriend, or whomever, who might decide that you and your crying child need to get out of here. I know this is what you came tonight to listen to, but we got to talk about it, because the things that really is bad about what racism or what it's done is it infected us, and we begin to act like our very own slave masters. We begin to see each other not as valued. We have little idioms that we say about a so-and-so ain't so-and-so. Y'all know the words. And it hurts me because I see how that plays out in the difference in our health outcomes. And those differences, yes, we can explain them in socioeconomic terms about jobs and the neighborhoods and access to care and so on and so forth, but all of those structures are not there by accident or not present by accident. I grew up one of 10 children. And I knew some of my cousins who lived in the projects. And I remember when it was time for the caseworker to come. And the caseworker come, we had to go over and get all my uncle's clothes and take them out of there. Had to take the phone out. And y'all, anybody else remember any of that? Yeah. Y'all remember? Yeah. Why? Because when the caseworker come, I never understood until lately how you incentivized a woman to have more babies but didn't want a man in the house. And what kind of house and what kind of family were you able to raise that way? I was trying to understand that until I understand its purpose for why it was doing that, to create the environment as toxic to these adult or teenage children as it was to that newborn fetus being born in a body full with some people or the person who may smoke, who was not able to get the nourishment that she needs to get on a regular basis, resulting in the sort of difficulty that a lot of our preterm infants have. And when I was at County as a CMO, having to see obesity in a whole different sort of way, and going to our NICU and seeing these babies as they struggled to breathe. Understanding that it wasn't their fault, it was our society's fault. Because somebody decided that because of the color of your skin, it wasn't as important for you to live in good housing as it was for someone else. And even if you looked at public housing, and the things that went around public housing, there were many, many things that were not where they need to be. So as we look at these children that are born into these situations, it's one thing to look at them in the hospital or even in the NICU, but it's another thing to think about what do they go home to and what do they grow up in? And what kind of examples do they see for the kind of people that they should be or not? And when we look at even what we say to our own children somewhere, you just like yo, that's why you're dark. That's why nobody don't be bothered with you. This happened to my sister. So we've got some internal things, Dr. Owati, and you're here listening to this in the family meeting. But I've listened and I've heard Dr. Allison Owati speak, and I know she cares. Yes. And she cares deeply, deeply enough to want to understand. And when we have problems in our community, when we have things that the family, because what's happened, this global white supremacy ideology has permeated us so well that we began to hate ourselves. And our actions show that, which is why we go from early on in the 60s and 70s when I look at Chicago, used to have 23 black automobile dealerships. Today we have 0, maybe 1. Several banks, and today we have maybe none. How many grocery stores? How is it that every other ethnic community person can come into our community, set up shop, we support them, but somebody that looks like us has a shop and we may not ever go? No, if I'm telling you, I'll sit down. I'll just sit down. I just have to say, because you as nurses has an obligation or a responsibility to heal not just the body, but to sit down and be able to empathize with somebody. Some woman who's been beaten by whomever, some person who's having an agonizing time with a disease and may not want to go home because they know what isn't there. And they know maybe what is there. I grew up in a home of domestic violence on a regular basis. And I say this because all of these things form the environments that children get born out of and influence the kind of children they will be. And what we have to do as as people ourselves is, in our own family, you got to look far sometime in your own house, let alone your own family. But we have to be better caretakers of providing the right environments for our children and for ourselves. Some of these toxic situations, and I think about these ladies that my nurses, when they were APORS nurses, would go out and talk about the kind of environments they saw these women in, many of them very destructive. It's no wonder why the child is sick or has problems. We all, you particularly, have gone to houses, and you particularly have been engaged with our communities in a special sort of way. And so when we've been doing our work, trying to think about the differences, many of our children never even get some of the psychological counseling they need. And they end up being abused because they don't know how to be anything different. They end up not getting fed. They end up not getting all kinds of different things. And I don't want to be here the rest of the night talking about this, but it was one thing to me to talk about neonates and COVID. But what about 10-year-olds in a house of abuse, or never where there's been a decent meal cooked for them, or not seeing the love that they should receive, or not feeling that they're wanted because they overhear, like I overheard some of the things my parents and step-parents used to say. Words hurt. And sometimes they hurt a long time. So as we go back to do the work we have to do, and we all need to do it, and sometimes we have to put on our mask when we go in. But many of the nurses, I was recently in the hospital, and I got to say I got wonderful care from the nurses that took care of me. It wasn't just what passing the meds and all that stuff, but it was the other stuff. So keep doing what you're doing. And if you're in public health, God love you, because that is tough, tough, tough work. Tough work. And let me thank you for every difficult situation. Let me thank you for when you've taken money out of your own pocket to try and get some milk or to try and do something for one of these children. Even if it's just talking to them, or maybe helping their mother with some of their homework sometimes, when you can, if you can. And I'm apologizing that I did not follow my script. Was it all right with y'all? But you know, now that I'm approaching 71 years old, I feel empowered to be able to do what I want to do. Thank you so much.
Now, I want everyone who was a part of the panel to please come up here so that our audience has an opportunity to ask questions of you. This is question and answer. Terry?
Terry, you
Come
gotta stay
back.
up here.
Come back. Questions and answers. Okay, is this yours? Okay, audience, I see at mic mic number 1, we have LaTanya Cannon. Okay, LaTanya. Oh, mic 2? Okay. Who's asking the question? We got 2 mics on the floor. I know you all have some questions for our panelists. Okay.
Good evening, everybody. Thank you for this absolutely amazing event. I've learned so much this evening. Let me start off by my name. I'm sorry, I apologize. My name is Dr. Faye Fumishongole. I'm a recent doctoral student from the University of Illinois at Chicago. Dr. Phyllis Matthews was on my committee. Thank you so much. My question is really for Dr. Mason. I was really moved, really moved by your talk just now, and I appreciate the fact that you stepped out of script. What do you want us to do as nurses? What are your expectations of us moving forward, especially those of us that have heard you tonight?
First of all, continue to be the professional you are, number 1. Number 2, and make sure that that professionalism always has a dose of compassion. Number 3, understand and always understand, as I'm sure you do, that that person that's in that bed who may be obnoxious or anything else is that way because something, not because of what you did or didn't do, but what happened to them before they got to you. You understand what I'm saying? And as best as you can, and I know your time is compressed, especially now. I recently spent some time in the hospital for an issue I had to deal with. And I spent almost a day and a half, 2 days down in the ER waiting for a bed. So I understand, and I saw the nurses in the ER, and when I finally got upstairs, just the tremendous weight that they were carrying, not just because of the patient load that they had, because sometimes they felt, I don't have enough to give. I've given everything I can, and it's not enough, but I want you to know, when you've given all you can, then you've given enough. And just be grateful for that. And keep up those kind words of encouragement. And I want the nurses to begin to encourage each other. You know, encourage each other. Because we're all in this together. And yes, sometimes doctors can be obnoxious and sometimes patients can be even more. But you know they're there because they hurt. And they're saying things because they're not quite themselves, at least at that time. Now, some are real buttholes, but sometimes you know the difference. You all got that sort of sense. Does that help you, ma'am? Does that help you? You're welcome.
So I also had a question for Dr. Mason, I believe. Okay. My name is Tamika Johnson from Chicago State University. As far as colorists in our community, where do you think we should start? Do you feel that music and artists of our own color use their platform and they play a major role as well?
Well, yes and no. Some of the stuff that I've heard coming out of our artists' mouths isn't so good. And we got to call that out too. Because we don't need them to feed negativity into the minds, into the spirits of our children. And we as adults got to stand up and say, oh, no. And we have to realize the forces that are at work working to conspire against you. Let me give you a quick example. I was giving a talk on gun violence. And there was and we were talking about how violence, guns and stuff are being glamorized in videos and stuff like that. And so there was and I said, but who's doing that? And so there was a guy by the name of Chief Keef who grew up in Inglewood, who made a record called I Don't Like. And Interscope Records gave this boy a contract that he was too young to even sign for several $100,000. But the real thing that was the tragedy is I saw a newspaper clipping about another young boy who saw that and said, I want to be just like him. And so the business community is not immune from being participatory in the kind of degradation and self-negation that is being put out over the airwaves for their profit. So as moms and dads and uncles and aunties, we have to do the best we can to bathe our children in love, self-respect, and no, just because somebody's dark doesn't mean they're dumb or they're stupid or they can be disregarded. Because when you look at the mirror, you're talking about yourself. So we need to make sure that we grab those tools to help our kids become more self-affirming in a positive way. Unfortunately, we see so many things out there and now, because of this, they got 24/7 access to craziness. And I'm gonna tell you, y'all still gotta be parents. You gotta set the rules and enforce the rules about how much of this they see. And maybe you need to understand how you figure out where they've been on their phone. I mean, it's a new day. I don't understand all this stuff. My 10-year-old grandson helps me out sometimes. But at the end of the day, I'm one of 10 kids. And one thing I knew about growing up in our house, and I heard it said well in one of these movies. You talk to your parents, and they say, don't give me no butter ruz. When my parents spoke, that was it. And if you didn't do what you were supposed to do, there was a message that would come to your behind to put some message to your mind about what you need to do the right way. Now today we got to be careful because you'll end up in jail. So we need to learn how to begin to get into their head and whip them here. That's why we got to be faster. And we got to get together as parents. Because one thing that I grew up, and I'll say this and shut up, I grew up on a block. I grew up in Inglewood, 69th and Low. And everybody on my block was my surrogate parent. Everyone on my block had license to do whatever a parent needed to do. Every person on my block today would be arrested for what they did. But I am so grateful to God that I lived in that block. And the other thing I want to say is we better put some spirituality back in our homes. Put some spirituality. I'm not telling you what church or nothing like that. I know we're in the Apostolic Church, and Reverend and Dr. Smith is a good friend of mine, a wonderful pediatric hematologist, I believe. And you're not perfect yourself, because many of us were raised in a damaged way. So we got to be honest with ourselves, because sometimes we need to go get help ourselves to be a better person so that we can be a better parent. And that's another public health issue, Allison, that we don't think about often. Did I answer your question?
Okay, you have to, so my thing is, how can we reach out to them? Because
who's the them?
like the like the artists and things of that nature. So I know you're saying like support people of color. So we want to listen to their music and things of that nature, but we may have to pull our children back because of the message that they send. So how can we reach out to them to help us? You know, we want to support them. We want to listen to their music. We want to buy their music. How can we help ourselves? How can we help them?
That label. You can get that label and get that information. One thing about this, you can get any information you want. And if you don't know how to do it, ask one of your kids. They'll tell you how to get it.
That's a great start, right?
That's a great start.
They play a major role in colorism in our communities.
And the worst thing that we have that is a vestige of our internalized, I'm going to say this about that, and I didn't say it about the AIDS thing. What AIDS did was took away your ability to recognize foreign invaders, and your immune system was unable to fight it, and you died from infections that you normally never would have died from. And I'm saying that the mentality of what we call racism did that to our own, it damaged our own immune identity system. So we don't know who or whose we are. We've been called Negro, we've been called all kind of things by self and others, but we've never been reaffirmed in the cultural way that we should have been or should be. And that's why I embrace a lot of the cultural things that tie us back to some of our roots on the continent, because in our names, because we're not these people. We need to understand our own history, and we can learn a lot from it if we implement it. And a lot of our people are truly perishing from the lack of knowledge of self, of who and whose they are. And the whose they are is something that we need to reinforce, because they're growing up without believing they belong or have to answer to anyone or anyone. But we didn't grow up like that. We had parents and God to answer to. And we had to pray every night before we went to bed. Some of y'all know what I'm talking about. So those were not bad things. And I know now we're telling our kids this, that, and the other. But I'm going to tell you, if you don't help put the fear and the knowledge of something bigger than themselves and bigger than you in them, they will have no moral compass to guide them. And they'll do and say anything to anybody.
My name is Joanne Dean, and I appreciate what the doctor just said, Dr. Mason, about knowing who you are and whose you are, and having some values and respect, and not looking down on people, because I myself am a retired RN from Cook County Hospital and Cook County Department of Public Health. So I know about public health. I know about employment interviewer, because I did that, and I went back to school and promised the nursing director, who was Jeanette Logan, that I would come back to Cook County Hospital and work. And I did. I worked critical care as ICU nurse, but I also got promoted to open up our AIDS specialty unit in 1989 as the charge nurse. But my concern is Dr. Awadi regarding, we know that the metrics will be dropped on Monday, and the mask requirements, except for the schools and whatever that has been outlined. I'm concerned because I like to sing, and I sing in the choir, but I took me a leave because some of the members caught COVID, and they were singing when nobody was there. So I'm just a little, I'm concerned about, you've outlined the schools and certain areas where masks will still be required. Have you looked at or thought about doing any talking about the number of people in the church, number of people as singing? Because I know if they're singing without a mask, I'm still concerned as a senior now. Yeah. Because I'm 78 and I'm concerned about my own health and underlying problems.
Yeah, absolutely, and it's going to take a second for my voice to come back. But what I would say is that, the reason that we are lifting that requirement at the city level is because the risk is low at this point, that when you are out and about in the world, you're going to be exposed to somebody who has COVID and doesn't know it. There are going to continue to be settings that choose to have masks in place, right? And if there are churches or choirs or businesses that decide to keep those, particularly, in the shorter term, I know people are nervous. That is absolutely something that we support. But I want you to know that the reason we're lifting this is because the numbers show that we are at a place where, we've gone from 10,000 cases a day in January to 250 right now in a city of 2.7 million. Yeah. And a positivity from more than 20% back down to less than 1.5%. And to have seen that amount of progress, and those of you who work in hospital settings know, finally the hospitals are also sort of able to breathe from a COVID perspective again. We predetermined those metrics. We didn't pull them out of the air. We said, what's the risk when you're out and about that you could be exposed? And so I can't promise you that there is no COVID. We're going to be living with COVID probably. But I do want you to know that when we make those recommendations is because I and my team truly believe that that risk is good. We got to, when somebody sounds like me, I want them to have a mask on regardless, right, of what's going on. And the masks are not going anywhere if people are isolated. They've been in contact with someone. COVID is not over, but in terms of having to have them on all the time, we are thankfully in a place where we can do that. We'll keep watching the metrics. The good news is the vaccine does such a good job keeping people out of the hospital. Not 100%, but it has been, we couldn't be doing this, without having that in place. And we're going to keep working, on doing everything we can to keep us safe. But when we are at a place locally where we can do that, I feel strongly that we should. Because if, God forbid, in the future, we're at a point where we have to take some precautions as a society, I again want people to trust that this is a moment when we got to do things that some people don't want to do. Thanks.
Any other questions? Okay, one more.
Sorry. My question is for Mr. Terry, for advice for future nurses that's in school right now for nursing. What is your advice? Thank you.
Do well.
I'm trying.
Okay, seeing that there are no other questions. Oh, there is one, yes. This will be our last question then.
Tracy Atkins from the Khan Academy of Nursing.
Okay.
And this question is for Dr. Cole.
Dr. Cole?
And I would like to know, do you have any incentive programs for nursing students at your facilities?
Thank you very much for your question. We do not have incentive programs for nursing students because you'd have to be employed there. But I do encourage you to reach out to get further information about opportunities. We do have extern programs that we've just recently brought back because of the pandemic. We had to back off of some of that over the last couple of years, but we do have very nice, robust extern programs where if you're a student and you've had your core requirements taken care of, you would be able to come into the organization paired up with a nurse, and some of those extern programs are paid programs. So please do reach out. I'm happy to share more information with you. Thank you for your question.
Okay, we've reached a point in our program whereby we're going to raise the offering. The church has been very nice to us, and it's only befitting that we reciprocate. And so at this time, we'll raise the offering. We'll ask our songstress and our accompaniment to please come. And I would encourage each of the speakers to dialogue with Dr. Awadi, because we need help. We need some answers. This is a public health issue, and it affects all of us. And whatever input that we can give, we need to speak to it now. Now is your golden opportunity. Okay? Jamaica.
Oh, give thanks unto the Lord, for he is good. Yes, he is good. Oh, give thanks unto the Lord, for he is good. Yes, he is good. For he is worthy, worthy. For he is good. Yes, he is good. For he is worthy, worthy. For he is good. Yes, he is good. Oh, give thanks unto the Lord, for he is good. Yes, he is good. Oh, give thanks unto the Lord, for he is good. Yes, he is good. For he is worthy, worthy. For he is good. Yes, he is good. For he is worthy, worthy. For he is good. Yes, he is good. He is worthy, worthy. For he is good. Yes, he is good. For he is worthy, worthy. For he is good. Yes, he is good. Oh, give thanks unto the Lord, for he is good. Yes, he is good. Oh, give thanks unto the Lord, for he is good. Yes, he is good. For he is worthy, worthy. For he is good. Yes, he is good. For he is worthy, worthy. For he is good. Yes, he is good.
God is indeed good, and we are grateful. Thank you, Heavenly Father, for allowing us to meet here this evening. Our program has not ended. We're just collecting the offering at this point. We do have the libation. We've had several nurses that we've lost during this pandemic. And their families are here, and we must pay tribute to them. They made significant contributions, and we appreciate those things that they offered, not only to their patients, but to the community of nursing and nursing professionals. So at this time, we do libation. What's the program calls for? I don't. Scholarships first. Thank you. We will do scholarships first, followed by libations.
Good evening, everyone. Haven't we had such a wonderful program thus far? Let's give tribute to our speakers for being here tonight. We thank you so much for your patience, and due to the lateness of the hour, we're going to move along quite through with the scholarships. I know many of you have been sitting here waiting for the scholarships, and so we want to take this opportunity to salute those that have excelled and continue to promote themselves in the spirit of nursing. And you see, we need you. And after all the speakers tonight, we see that there's plenty of room for nursing. It's holistic. We need you, we support you, and we want you to know we're behind you, not just in word, but in financial support. So on that note, I want to present to some the scholarships for this evening. We have 5 students that have qualified for the nursing scholarship, but I do want to preface that with the Provident Hospital Nurses Alumni Association, which is responsible for the scholarships we're giving out tonight. Just a tidbit to let you know, the Provident Hospital Nurses Association consisted of graduates of the Provident Hospital's School of Nursing. The Alumni Association had been in existence since 1891. But in March of 2020, the Alumni Board voted for the dissolution of their organization because of aging and declining membership. Upon dissolution, though, board members Louise Broadnox and Pearlie Davis endowed the National Black Nurses Day Planning Committee with monies to be used as scholarships for Black students currently enrolled in accredited schools of nursing. The scholarships will be presented on this night in celebration of the 34th celebration of National Black Nurses Day, here today, February 25th. I am going to call out the 5 students tonight. Actually, 4 are here of the 5. 1 is not here due to her work schedule. But we want to present you with the scholarship from the Provident Hospital Nurses Association. As I call your name, please come forward. We first have Felicia Clark. Felicia will be a graduate from Chicago State University. Okay. And we want you to know that Felicia has been awarded a scholarship of $1,000. Our next student is Brianna Daniels. But Brianna is not here tonight, but yes, go ahead and salute her. She will be graduating from Chamberlain University. Our next student will be Valerie Fraction. And Valerie is graduating from Chicago State University. And Valerie has been awarded $1,000. Our next student is Tamika Johnson. And Tamika Johnson will be graduating from Chicago State University as well. And she has been awarded $1,000. And finally, we have one representation of the male student. And his name is, and please forgive me if I mispronounce the name, but I believe it's Atman Mwagwa. And Admin is actually being awarded $1,000 for scholarship, and he has attended Chicago State University. And I believe all of our graduates will be graduating this year. I believe December. Are you December? You're going to be next year? Okay, he will be graduating next year, but the other graduates are graduating in 2022 this year. Congratulations to all of our recipients.
And so now we're ready for our libations.
Good evening, everyone. We have just had a fantastic evening. I would like to thank our panelists. They just did a fantastic job on enlightening us and giving us very, very good information. So thank you all once again. I'm Carolyn Rimmer Owens, and I'm a member of the Chicago Chapter National Black Nurses Association. To my left is my colleague, LaTanya Cannon. She is the president of Lambda Pi Alpha Sorority, and also she's a member of the Chicago Chapter National Black Nurses Association. So what is libation? Libation is an African and African-American tradition of pouring water to honor our ancestors, those that have gone on before us. So that's what we will be doing tonight. During this ceremony, we have plants there that are green, and we will be offering those living plants to the families in honor of the life and legacy of their loved ones. Tonight, we honor 12 of our nursing colleagues who have made their transition in this past year. These nurses are highly regarded and have made numerous contributions to the field of nursing and the community at large. 3 of the individuals tonight that we honor are trailblazers. As I call their names, I will expound on the significant roles they played in elevating the playing field of nursing for generations to follow. The first is Beta Mu Chapter Lambda Pi Alpha Sorority. Hannah Vineyard, libation. Is anyone here for Hannah's Vineyard family member, friend, representative? Okay. The next person is Marilyn Dancy, Providence Hospital graduate. She trained with the Army Nurse Corps during World War II and was the first Black operating room nurse at the former Michael Reese Hospital. Libation. Is there anyone here for Miss Marilyn Dancy? Please come. Is Marilyn here? Thank you. The next honoree is Miss Louise Hoskins Broadneck. Many of you remember Louise. She stood here with us for many, many years. Miss Louise Broadneck was a Providence Hospital graduate. She was the first Black nurse to serve as Director of Healthcare, appointed by the late Mayor Harold Washington. She was an active member of this Black Nurses Day Committee for many years. She represented her alma mater as president of Providence Nursing Alumni Association, which was the first nursing association in Chicago. Libation. Is there anyone here for Ms. Broadneck? Please come. June Shivers, libation. Dorothy Stiggers, libation. Thank you. Ada Harris. Ada Harris was the first and only LPN to serve on the Illinois Board of Nursing. Libation. Her family's here. Please come. Thank you all. Thank you. Thank you. Kimberly Hollowell, libation. Thank you so much. Thank you. I'm sorry.
Her husband is an active colonel in the military.
Who, Miss Hollowell?
That's right, Mr. Hollowell, Colonel.
Oh, Colonel Hollowell, I do apologize. I wasn't aware. Thank you. Geraldine Jones, libation. Thank you all. Thank you. And for all those healthcare workers who have laid down their life, we pour libation. Now at this time, I would like to invite you, the audience, so that we may pour libation for someone that perhaps was special in your life. Perhaps a nurse, perhaps someone that you work with, maybe a family member, someone that was supportive, but just a nurse, someone that stands out that really you would like for us to honor tonight. Can you begin to just call out their names? Can we start over here? Is there anybody? I'm sorry. Did you say Everett? Edgar Tate Sr., libation. Michelle Wilkerson, libation. Marilyn Danzy, libation. Just call out the names, I'll hear you. Willie Mae Booker, nurse, libation. Janine Telemack, libation. May Russell, libation. Did you say Lawrence Powell? Lawrence Powell, libation. Mildred Lee, libation.
Valita A. Sanders, a.k.a. the Word Nurse.
Valita A. Sander, a.k.a. the Word Nurse, libation.
Charlie Mae Alexander.
Charlie Mae Alexander, libation. Dorothy Gillespie, Chicago chapter, libation. Christine Long, libation. Sheila Phillips, libation.
Maddie Harvey Brown.
Maddie Harvey Brown, libation. Did you say Donnell? Gaynell Drummer, libation.
Agitate Junior, her brother.
Agitate Junior, her brother, libation.
Arthur Burgess, he was a nurse.
Arthur Burgess, he was a nurse, libation. Lydia Roberts, libation. Cynthia Willis, libation. Linda Evans, libation. And for me, Elizabeth Taylor, libation. Thank you all.
Now, I don't have my program, but I believe recognition of nursing schools. So now we're going to ask the nursing schools to please stand up in order and come No, just stand up. So Jackie, what's the first name?
We had several nursing schools sign in, so we had First Step to Excellence.
FSTE, First Step to Excellence. They're located on 87th and East End, okay?
The next company is Chicago State University.
Chicago State University.
We have ESTE.
I think that was probably FSTE, which is First Step, so we've already honored.
Khan Academy.
Khan Academy. South Suburbs. Malcolm X City College of Chicago. One student here from Olivet, Nazarene. Thank you. We're so proud of our nursing students and the nursing schools. Thank you so much for being here and being a part of our 34th annual National Black Nurses Day in Chicago. I trust that this event will forever leave a lasting impression in your hearts and in your minds. We're trying to make certain that we look at the healthcare issues that you're facing in school and we're facing within the hospitals and the communities, and collectively to look at what we can do in order to enhance our survival in this world. In Jesus' name, we're going to have a prayer and we're going to close. I'm going to ask Evelyn Collier-Dixon to please come forward. Oh, okay, come on. I'm so sorry. Okay.
Thank you, Dr. Lacey. Okay. Let every heart pray. Eternal God, our Father, we thank you, Lord, for this gathering of health professionals here on this evening. We thank you for the wisdom and the information that has been imparted to us on this evening. We thank you for every school that's represented here on tonight. And we ask, Lord, that you would continue to strengthen them and undergird them and help them to be encouraged to understand that the race is not given to the swift, but to the one that will endure. We ask that you open their spiritual eyes, that you give them wisdom and give them revelation knowledge from the throne room on high. We're thanking you, Father, for those that have retired from this great profession of nursing. We're thanking you for those who continue to serve and ask that you would renew their strength. And Father God, we're thanking you for those who are waiting to receive the baton. We thank you for everything that has transpired in this room tonight. And as we prepare to go from this place, but never from your presence, we ask that you would prepare the way. Send the angels before us. We bind all accidents and incidents in the name of Jesus. And Father God, we thank you in advance. We decree these things to be so. We believe them. We receive them. We give you all glory. We give you all honor. We give you all praise. And it is in the mighty, matchless name of our Lord and Savior, Jesus Christ, that we pray. And the people of God together said, amen.
This concludes our National Black Nurses Day in Chicago, 34th anniversary. I trust that each of you will drive safely home or to your various destinations, and we thank you for your attendance here this evening. Thank you. Good night.